Hello, my name is Jane Lawson. I'm the matron for emergency care here at Southport and Allsquare Hospital. Currently stood in our ambulance triage area, which is an area which accommodates up to 5 patients who arrive by ambulance. We've started working very differently through COVID, and I'll give you a walk through the department of how we're separating our patients right from the front door. If you'd like to come with me. So as you can see, we've got the 4 ambulance cubicles here, and then we have the walk-in triage here. So patients, if you went by ambulance, will be here, offloaded, triaged by a senior A&E nurse, and then screened. The screening within the department includes streaming through to our new SDEC area, streaming to the surgical assessment area, streaming to minors, and either through to red majors or through to amber majors. You'll notice here that we've had our new Omnicell installed, which will support us with our medication dispensing. We've had this in all areas of the department. We've got it in resuscitation, we've got it in amber majors, and obviously got it here. I'll take you through to our resus department. As you can see, we've currently got work going on here. These 2 cubicles have just been completed. We're just waiting for the installation of the new sliding doors. And ultimately these cubicles will become negative pressure rooms. So I'll just show you briefly inside. Everything's been white rocked in line with infection control guidance. We've got all our kit in and just a much better, safer area for the patients requiring resuscitation. From Monday we have all these cubicles back and completed, and then we'll start with the work in the main department. So now coming into the main department, which is our red majors. As you will see, we've got all our cubicles and now have doors on them. Currently these are temporary doors, but the work for this door area will start on Monday, and each door will become a permanent door. So that gives us 15 cubicles with doors, plus 3 cubicles in resus. And we'll also notice the illuminated lights in the ceiling. We're going to have them fitted in every cubicle as well, because not all our cubicles have windows. On this side of the corridor we have our amber area, which was originally our observation ward and our minors area, and this has now been changed to our amber majors, which can accommodate up to 14 stretcher patients. Up here we have 1 to 5. There is currently work going on here as well. We're having an extra storage area and a new nurses station built, and then into the observation area wall here we are having studded walls in between each bed space to create segregation for the patients, and that will give us 14 functioning A&E cubicles in addition to what we have on the red majors side.
My name is Khalilullah Wahdati. I'm the clinical lead for ambulatory care service at Southport Hospital. Today I'm going to touch briefly on our services. Ambulatory care service is a high quality clinical service at hospital where patients are assessed, diagnosed, treated and discharged on the same day with senior clinical input on the spot. We run an ambulatory care which is now located on the same floor as emergency department, which make it easy to pull patient from ED and help with the flow. We have a very enthusiastic, experienced staff working here with good communication skills and clinical skills. Regarding the referrals, we accept and we're happy to accept referrals from primary care. All the GP practices in Southport and West Lancashire can do an electronic referral to our service. The criteria for that is it has to be non-COVID, it has to be an acute condition, and the patient can wait for 48 hours to be seen. If a GP or any colleague in primary care thinks the patient needs to be seen more urgently, there's an alternative pathway for emergency department, and the patient can be sent to ED and we will pull it from there if it is with the criteria for ambulatory. We work on integrated pathways with the community to help utilize the resources and utilize the services in a better way and to work together for better and safe care of the patients. We also work with Northwest Ambulance Service, and they can directly refer patient to us if they seem is appropriate for ambulatory. Regarding the benefits of the ambulatory care service, the patient will have a senior input on the spot. Patient experience in clinical outcome will be good. The rate of admission will be reduced. The rate of complaints and incidents will be reduced. And also, for the training for the staff is a good as well from the training point of view. Your patient experience, your staff experience is always improved. The future, we aim to take 30% of acute intake on our ambulatory service. We will be working very closely with our colleagues in the community in the front door to pull as many patients as possible. It will improve the experience of the patient, and at the end of the day, it will help. The patient will have the same treatment, the same management while they're having is an inpatient, but they will end up in their own house, in their own environment, having full treatment given during the day.